No problem.
Ma'am, when did you choose Ops and Gyne as your dream? How is the work division based on first year and second year, where they are posted? Ma'am, what about the duty hours in SGH and Niloufer, ma'am?
Cases and
I think this is the biggest advantage in Osmania when compared to other government hospitals.
Easily done. I think 1,000-1,200 C-section. When you asked me why I chose Osmania, was primarily because of the caseload. So higher caseload, more chances.
Ma'am, what about the fee structure and stipend?
At once you will become rich, and at once you will become a poor person.
What about the academics teaching?
When I was in my post-graduation under the guidance of Dr. Malti, we stood second. First was AIMS, All India. Thank you. And we stood second and on shoulder dystocia.
I hear that many assistant professors are transferred to peripheral medical college. Is that really affect? What about the super specialty scopes in Department of Obstetrics?
Branch, I'm so sorry to burst your bubble. This is a myth. OBG is not an end branch. The most successful gynecologists in India are men. You can have one Krishna among all the Gopika.
Hello everyone, welcome to our YouTube channel Osmania Docs. Are you planning to take Osmania Medical College in NEET PG admission? Let me give you a real inside story about the residency life here. In this video, I will discuss about the teachings, academics, super specialty scopes, working hours, work-life balance, post-PG stipend, post-PG salary, and what not. Today we have topper, gold medalist Dr. Tanya Ma'am, Department of Obstetrics and Gynecology, senior residency in Ghani Medical College, and completed her residency in Osmania Medical College. Let's take brief review about the Obstetrics and Gynecology department in Osmania Medical College.
Hi Anil, it's a pleasure to have you, have this interview with you. Thank you so much for giving the opportunity.
Thank you, ma'am, for spending a valuable time.
No problem.
Ma'am, when did you choose Ops and Gyne as your dream branch? Whether in the internship or completion of the NEET PG exam?
Okay, so basically I feel your core interest, whether you want to take a medical branch or a surgical branch, depends when you are in your internship. It's only after your internship that you get some clarity. Studying a subject, enjoying to study a subject is different, and loving to practice that subject is a completely different thing.
Exactly.
So when I was in my internship, I realized that I love to be in an operation theatre. I love to do surgery. So I decided that I want to be a general surgeon actually at the end of my internship. And then when I was studying for my NEET PG, to be very honest, I think I don't get inspired by this. But when I was studying for my NEET PG, I did not want to get back into the rat race. It was a lot of preparation, and I thought, okay, I don't want to go into another competitive exam zone. So I wanted an end surgical branch. And then that's when I zeroed down to OBG, because I thought, okay, this is something.
Anyways, you are in operation theatre.
Yeah. So I get an exposure to both medical and surgical thing, and then I thought it's an end branch then, so then I can don't have to write any competitive exam later. But yeah, that was primarily why. So I decided during my NEET PG preparation that OBG is the only department I really am interested in working.
Okay, ma'am. What things motivated to choose Osmania when compared to other medical colleges?
To be very frank, Osmania has 3 hospitals for OBG. One is Sultan Bazar, Petlabuch, MGMH Petlabuch, and Niloufer. And where I have done my post-graduation from is MGMH Petlabuch. That you can even research is the biggest hospital in South Asia dedicated only for obstetrics and gynecology.
It is also called as a factory, delivery factory.
Yeah, so exactly like you said, so it's the biggest. It's literally a 5-floor building dedicated completely to women for obstetrics, gynecology, childcare, neonatology, and that's when I decided that and plus I am a student, like I am a local of Hyderabad, so I thought if at home I'm getting such a good exposure, then I would be a fool to leave Osmania. And to be very honest, the number of cases that we get here, the variety of cases that you get in Osmania is splendid. Like I think every textbook case I have seen at least 30 to 40 times just in my first year of post-graduation.
Really so great.
Yeah, so we were like thorough, when by the end of PG you can just be blind and do.
You can set a hospital directly after.
Yeah, that is maybe, probably, but the confidence levels that you get in Osmania is amazing, especially the case handling, and as a doctor, it evolves you as a person, as a doctor, when you handle such crash situations. So it's beautiful. The caseload in Osmania is, I don't even think I should be saying this on a live platform, but I think a lot of central institutes also don't have the kind of caseload, especially Petlabuj for obstetrics and gynecology has.
Yes, ma'am. Ma'am, how many PGs are there in Osmania, ma'am? Department of
in
Obstetrics and
OBG.
Gynecology.
Okay, so basically we were, for my batch, until my batch and my juniors, we were 35 PGs. So 35 PGs were divided into 3 hospitals. So you have your NEET PG counseling,
Yes, ma'am.
where you are allotted Osmania. Again, within the 3 hospitals of Osmania, we have an internal counseling, and we are divided rank wise into first toppers in
Okay.
MGMH, middle 10 rankers in Sultan Bazaar, and the last 10 in Niloufer.
Okay.
Sometimes the pattern changes, that they keep first in MGMH, second in SBH, but that has not happened yet. It's always under discussion.
Okay, ma'am.
Now the seats from my sub-juniors batch, which is 2023 batch, the seats are 60.
60.
So there are 25 PGs in Petlabuj and 15 and 15 I think in...
Almost double now, ma'am.
almost double, exactly. We were 35 and now they're 60.
60.
So totally 60 seats, yeah. Again, in that Petlabuj has 25, and every year it keeps changing because it depends on the superintendents and the caseload. But it's always Petlabuj has higher number of seats compared to Sultan Bazaar and Niloufer.
Ma'am, how is the work division based on first year and second year, where they are posted? Completely give you a brief, ma'am. about
Okay.
this. How department works?
So we have allied branches related in obstetrics and gynecology. So we have labor room, which is core high risk obstetrics, which is the emergency unit, and then we have a gynac OP, gynac wards. We have infertility, which is completely related to couples trying to conceive pregnancy, where we have IVF, IUI, ovulation inductions, and then we have family planning, which is for contraception and sterilization, that particular unit. So in first year we are rotated, so all the 25 PGs, we were 18 in Petlabuj, so we were divided in 3 units. There are 6 units, 3 PGs in each unit, and one from each unit is again posted in rest of these. One in infertility, one in emergency labor room, one in gynac. So we are posted like that, one in family planning, and we keep rotating like that. So our core labor room has first stage eclampsia room, which is completely for hypertensive patients, and then we have a major labor room. Then we have ADR, which is basically the casualty of our hospital, where we again have 3 doctors, one first year, one second year, and one third year.
Okay. Along with this, senior resident and assistant professor will be also there.
So mostly the work genuinely on the field is done by the postgraduates and interns. So most of the work on field is done by them, and the senior residents and assistant professors are there to give guidance and teach them. Hands-on is given to the PGs, and we monitor their cases. Very high risk cases we interfere, but there is always one assistant and one senior resident present 24 hours in our hospital. At least.
How many units are there, and how will you get OPs, and how many duties you will get per month, ma'am?
So in Petlabuj, so basically like in Osmania, like I said, we have 3 hospitals, which is Petlabuj, Sultan Bazaar and Niloufer. So in Petlabuj we have 6 units, and we were 18 PGs, so we were 3 PGs in every unit. In Sultan Bazaar there are no units actually. There were 2 units initially, but in Sultan Bazaar the division doesn't happen based on units. We have an OP posting, OT posting and ward posting. So everyone is divided like 10 members in each, or 5 members in each, based on how many students have opted for Sultan Bazaar. In Niloufer there are units. I'm not really sure because recently we had transfers. So we have 3 to 4. Yeah, we have 5 units, and then they have a Saturday Sunday rotation, so separately. Then again in every unit we have a professor, associate professor, assistants, which should be around 3 to 4 assistants based on how many, like first unit has higher load, so more assistants in that unit, and then 1 or 2 senior residents, and then PGs in every unit. So yeah, so it depends on where you are. So now in Petlabuj, because we have 6 units, we have Monday to Saturday every unit doing duty, and then we have Sunday based on rotation. In Sultan Bazaar they have their own roster, so there needs to be 2 to 3 PGs on duty every time. So because there are no units, the PGs make their own roster. In Niloufer, again same, PGs make their own roster, but sometimes when they do unit wise, it is Monday to Friday rotation, and then Saturday and Sunday. So usually number of duties are slightly more in Sultan Bazaar and Niloufer compared to Petlabush.
Around 4 to 5 duties
Yeah,
will get.
monthly we get minimum you will get 4. When you have a Sunday rotation 5. Also in first year I would like to mention there is something called post-op duties.
Yes,
So that post-op duties is for first year PGs. And that will be twice, maximum once or twice a month. Now there are more PGs, so they'll have lesser duties, but ideally 1.
Okay, ma'am.
So totally 6 to 7.
Ma'am, is there any post duty offs as many of our NEET PG aspirants are asking about post duty off?
No, unfortunately for postgraduates there is no post duty off, and for senior residents we have post duty off. Like right now I'm a senior resident, so senior residency is the first period of your career when you can take a post duty off. As such, PGs are expected to continue after the duty is over, and honestly, to be very frank, that is the time that tests your stamina and energy and mental strength more than the duty. Because see, as a doctor we have to understand that especially when you're opting for a department of OBG, it's very easy to go do a 9 to 5 job, sit in front of a system and come back home, but it's very difficult when you're doing a 36-hour shift. So you have to be your best in the OPD, best on duty, and then you have to continue and be your best. To be very frank, it's a little hard on us physically and mentally. But then that is how it is. So
you have to do OP on the same day, then you have to, when the duty day same, you have to do operations. Yeah, it's very
so we have OP, we have immediately we do duty, and then the next day we have OT. We prepare list and we operate, and it takes you time. First year is the hardest, to be very frank, because it's all physical work. But then you get used to it. After 3-4 months you will get adjusted, and then you will find it easy. Works keep reducing as you advance higher up in PG, because you do get juniors, you do get people to help you out, and you're operating more. And to be very frank, when you're getting to do a surgery, you'll be happy to continue the next day. You'll feel that adrenaline. That's why we doctors are a different species, compared to others. That's why we are special, and that's why we get so much respect. Frankly, on human grounds it's wrong that we don't get offs. We should. But I guess there are reforms happening. People are trying to speak up about it, and hopefully in the near future.
What are the duty timings, ma'am?
Now, duty timings. Duty starts from 2 o'clock and goes on till 9 o'clock in the morning. So 2 p.m. to 9 a.m. the next day. And then we continue again from 9 a.m. to 2 p.m. the next day.
How many cases will come in duty, ma'am, in and around duty day?
Duty day, many. There are chill days and then there are busy days. Okay. On an average day, we have at least in Petlabush. I'm speaking to you corely about Petlabush because that's where I did my post-graduation. So we have at least 30 to 35, 40 normal deliveries happening in one duty, and then at least 15 sections, minimum 15 C-sections. So totally about 50 deliveries you can easily say.
Per day?
Per 2 p.m. to 9 a.m. If you can consider 9 a.m. to 9 a.m., then easily 70 to 80 per day.
Okay. Ma'am, what about the duty hours in SBH and Niloufer, ma'am?
Core duty hours are the same in SBH and in Niloufer. So duties from 2 to 9, but everyone is expected to continue the next day. So ideally, if you come to duty at 9 o'clock on a Monday morning, if you have duty on Monday, that means you're going back home easily at 2 p.m. on Tuesday. So you come at 9 a.m. on Monday and go earliest at 2 p.m. on Tuesday. Sometimes it can be more, like in first year there are days when I went at 10:30 in the night after writing case sheets and everything, because first year there's a lot of work.
Based on the caseload?
Yeah, based on the caseload. Luckily now there are more PGs, so the workload is divided. But also the number of section chances and the cutting chances have reduced, because we were only 3 PGs per unit. And there is hands-on is very easy compared to our juniors. So that is the only slight disadvantage now, but that's when you have 50 patients, then it doesn't matter. They will do, we have done 4 or 5 in every duty, they will do 2 or 3. That's it.
When you get a hands-on surgeries and procedures, ma'am?
So in any surgical branch, you have to earn your chances. You have to be good to your seniors, you have to be good to your professors, and how good you are determines how fast you'll get your first chance. But in a hospital like Petlabuj, with the caseload we have, between 3 to 6 months, everyone would have finished their first section. So they'll start giving you from the 3rd month of your PG, and then full-fledged section by 6 months. So everyone would have done. So because the caseload is so high that we want to make our PGs learn, juniors, so that they can easily do the easier cases. And
I think this is the biggest advantage in Osmania when compared to other government hospitals also.
I have easily done, I think, 1,000-1,200 C-sections in my post-graduation. Because we have, like I said, in duty we have 20 sections. So we were 3 of us, and each duty like 15-20 sections, so easily we get 4 or 5. We have an elective list which has at least 10 cases, again 2 of us only, because one will be in DRP or peripherals, 5 each. So in a week I do like 10-15 sections. So if you see 3 years, that will be easily 1,000 to 1,200. And normal deliveries, so I have stopped counting. I think some easily 2,000, 2,000, 2,500.
Now cesarean section you can perform between 5 to 10 minutes, I think.
Yeah, not 5 to 10, but like 20 minutes max. Skin to skin, 15 to 20 minutes, and we are out.
That's really so great, no?
Yeah, no, but all thanks to Osmania.
Yes, ma'am.
But all thanks to Osmania and our professors, faculty, the caseload, the patients. If there are patients, then you'll get chances. If there are no patients, then in a surgical branch, the caseload is very important when you're choosing a branch. Like when you asked me why I chose Osmania, was primarily because of the caseload. So higher caseload, more chances.
What about the fee structure and stipend, and what is there in bond now?
In Osmania particularly.
In Osmania.
So, fee structure is say 20,000 odd, 20 to 25,000 in a year. Ideally, they take it only once a year, and then after that, maybe it gets cut from your stipend.
Okay.
So only when you're joining, we pay, and then you pay the sports fee, library fee, the alumni fee, everything in the starting, and then when you're leaving. So I think together it's not even going to be 50,000. Not even, I don't even think it is reaching 40,000.
Okay.
And then stipend has increased very recently. So now as a senior resident, I get 1,06,000.
Okay.
And when I was in post-graduation, for us it was 55,000.
Now presently, first year is getting
67 and
second year 71, third
75.
year 75.
So now it has increased very recently.
Is it credited at time?
It is?
Credited on time or it may delay?
I am actually also, I was a member of Judah when I was in my post-graduation. So we have to struggle a lot to get our stipends on time. But we do. Eventually, you may not get it every monthly, but they give you once in 2 or 3 months. But at once, you will get the 3 month stipend. It's not that once in 2-3 months, they'll give you 1 month. So at once, you will become rich, and at once, you will become a poor person.
But I recently heard that our Telangana government has allotted a green channel for this stipend.
Yes.
From that onwards, we are getting in and around 20 days.
Last year, we actually did a strike. For regularization of stipends. Now there is a green channel. So now it's much better than previously. So 1 or 2 months maybe, but mostly by 15th of every month, we get our salary 70% of the times, 60 to 70%.
What about the academics, teachings, seminars, classes?
Seminars, classes, they're all very good. So in Osmania, because we are 3 different hospitals, we have one class which is a combined class for all 3 hospitals on once every week, usually every Wednesday when we all meet. And otherwise the 3 hospitals have their own teaching program, own classes and everything. So at least weekly once we have case presentation, weekly once we have a seminar, monthly twice we have a journal club. And then we have maternal mortality, perinatal mortality meets. So approximately in a week we have 2 to 3 classes easily.
Okay, ma'am. Case presentation will be done by first years or second years?
Yeah, first year, second years, PGs, completely. Even the classes will be done by PGs. So our classes are not very, like in any post-graduation institute, classes are not like a UG system where somebody is teaching you and you're listening. So it's presented as a case. Mostly since we are Osmania and since we have such a good caseload, most of our classes, we get our textbook cases from our hospital itself. So if we have a case on triplets, we'll find a triplets case in our hospital. It's literally like that. that. So we find the case, then we discuss the case history, present it, and the case is discussed, and our faculty tells us how we could have managed, what better things we could have done, how we should manage such a case, what we did well, what we didn't do well, and then there's a discussion on that particular case. Sometimes we get the patient and examination is shown to us.
Okay.
Sometimes we have hands-on classes, like for instrumental delivery. On mannequins we are taught.
Okay.
We even do on patients, but we have workshops.
Okay.
So being Osmania, we are the prime institute for a lot of workshops and conferences that happen for OBG all over the state. So we have hands-on surgical workshops, hands-on vacuum forceps workshops. They have taught us suturing on pig tongue and pig fat, and we have practiced before
All these
practicing.
are happening in Osmania?
Yes, this happens in Osmania.
Okay.
So we have these classes, and everything is taught on mannequins. We have represented the state in all India level conferences.
Okay.
So Petlabuj, when I was in my post graduation under the guidance of Dr. Malati, we stood second. First was AIMS, all India. Thank you. And we stood second, and on shoulder dystocia. So we did a drill on shoulder dystocia. So there are a lot of these, exposure is very high. You get to represent yourself in a lot of state, national conferences.
And as you told about the ma'am, I hear that many assistant professors are transferred to peripheral medical college. Is that really affect in choosing Osmania, ma'am? What do you say about that, ma'am?
Yeah, that what you heard is definitely true. A lot of transfers are happening because there is now a government medical college in every district. So they want a faculty to be teaching in these hospitals as well. So they have taken core faculty from Osmania and Gandhi, and they have transferred in peripheries. See, that affects teaching to some extent, but the good thing is that completely the hospital is mostly run by PGs. So hands-on is not affected. To be very frank, this happened when we were in third year. So luckily our first year, I would really say that we are a very lucky batch, in the sense that when we were in first year, we had all the faculty, we learned from them. And by the time we reached third year, everybody left. So we were the only ones left to teach our juniors. So there are professors, everybody has not been transferred. 30 to 40% faculty have been retained. We've actually even spoken to government, lot of issues are going on, and students have spoken to, higher authorities. And now professors are being allotted to Gandhi and Osmania. Now the senior professors who were in peripheries before, they have been transferred to Gandhi and Osmania now.
Okay.
So now there is no such shortage.
What about the super specialty scopes in Department of Obstetrics?
Yeah. Like I said in the beginning that OBG is an end branch. I'm so sorry to burst your bubble. This is a myth. OBG is not an end branch. I did not know this when I was in my preparing for my NEET PG, and I really took it because I did not want to study after post graduation. But guys, it's unfortunately a myth. So OBG is no more an end branch. We have MCH branches and super specialties within our own branch itself. So there is urogynecology, gynec oncology, we have genetics, we have reproductive medicine, which is basically infertility. We have high risk obstetrics, and then there are a few other branches also coming up, but they are fellowships. Like we have fetal medicine, we have cosmetic gynecology, we have functional gynecology. These are basically as of now fellowships, but eventually they are going to be hopefully making them into MCH specialities. So right now core we have 5 MCH specialities.
How is the senior junior bond in Osmania, ma'am?
See, it's very dynamic. It depends on your seniors, how your seniors were, how your juniors. No two batches will have the same senior junior bond, to be very frank. When we were first years, we joined after COVID. So we were that post-COVID batch. Our seniors were first years for 1.5 years. And we were first years only for 7 months. So our seniors, poor thing, they've seen a tough time. And because of that, there was a lot of friction and toxicity between them and us. But they were just stressed, Now we are, see, toxicity does not necessarily mean scolding that person or taunting that person. For us, toxicity was also because there was so much caseload. Yeah, and there were just 2 batches, them and us. They were about to be going for exam, and we are, just joined, we are still learning. So we had that pressure that, తొందరగా నేర్చుకోండి మీరు సీనియర్స్ అయిపోతారు అప్పుడు ఏమవుతుంది. సో under that pressure, so we used to get 10 minutes for dinner and 40 minutes to sleep in one duty in 36 hours. which was very less. But then we decided, as a core, because we were so, a lot of my friends have cried, have wanted to quit. See, this happens no matter which branch you are in. Let me be very honest.
Initially, there will be some tough times,
Yeah.
and later we can manage.
Yeah, because see, your UG life and your PG life are two very different entities. You cannot, there's no comparison. So it takes a lot of time to get adjusted. So you will find it difficult. But then when you decide, I always say that you will be a senior someday to someone. Maybe you're a first year now. Tomorrow you will be that second year who will be an inspiration to that first year. So if you, because we face a lot of toxicity, we decided as core, a very core thing that we are going to be nice to our juniors, unnecessarily. We will try to make the environment better. And to be very honest, it has happened. At our level, how much ever we could try, it has happened. But in a department with high caseload, see, these days there are departments with low caseload also where you're seeing, I recently read a news about a dermatology PG committing suicide. So, it's in the medical field. There's no escape. You cannot change somebody else if they are toxic or not.
You should prepare mentally before choosing the branch.
Yeah, and you can change yourself. Like, you can decide what you want to be as a core person. You can't change your senior, but you can change the kind of senior you are to your juniors. And when you do that, probably one day this cycle and this chain will break, and then the toxicity in the department will also reduce. But yeah, there is a little bit toxicity, but it's not that, you cannot deal with it.
As caseload is there, somewhere. From you are saying, I understood that toxicity is because of workload only, from not the seniors.
No, nothing. And otherwise also you have a lot of support groups, you have a lot of help, you have your friends, you have your batchmates. So, you can always rely on them. And one thing I would also strongly advise people to do is, stay in touch with your family, stay in touch with your friends through post-graduation. That helps, dealing with the toxicity.
What about the post-PG payment now? How you can settle in future life scopes?
In OBG, right? So see, in any branch, especially in OBG, you have three options. One, after PG is what I'm speaking. You can go in for a government job, you can go for a corporate job, or you can start your own setup. So when you go for a government job, the pay will be around, say, 1 to 2 lakhs as an assistant professor, which is after, like now we are senior residents. So senior residents, sorry, I forgot to mention 1 year bond, right?
Yes,
about the bond, there is 1 year bond, which is called the senior residency period. And it's a mandatory bond in all colleges of Telangana, including private and government. And the penalty for breaking the bond is 20 lakh rupees. So senior residency, which I am doing right now, is the period of bond, is the bond period. So it is called senior residency. So that is 1 year. After that, if you join government, you will be an assistant professor. So assistant and then associate and then professor. So salary keeps changing and work keeps changing at every level as you get promoted. So government job, secure job, good salary, but a little less for the amount of work you're doing. Then you have corporate job. Corporate job is basically like a 9 to 9 or a 9 to 7 job, little hectic and very different from how a government hospital works, because we learn about insurance, you learn about patient care, policies are different, but pay is again more or less the same. Private job is the third option. You can have your own private setup, but it requires you to have a lot of timing. You should be able to give a lot of time. And another only one major disadvantage in obstetrics and gynecology is the MLCs. There's a lot of medical legal issues in a department like OBG. So when you're in a government job, you are protected, sort of relatively, compared to having your own setup. So it depends. Salary is not the only thing you should think about in especially departments like pediatrics, OBG, medicine, surgery. You have to think about medical legal issues, cost of setup, work hours, what are your demands, like if you want a work-life balance or if you want to go abroad and work. So it depends on a lot of those things.
How is work-life balance in the department now?
See, there is work-life balance is again your choice. Right now, since I'm in a government hospital, so there is a good enough work-life balance. I can, not very good, not very bad, but at this point also, like you get one duty per month, work hours are okay. You can maintain a work-life balance, but obviously some sacrifices you have to make. But yeah, good enough. In a government job, you may get some time for a work-life balance. But yeah, I can give time to my friends, I can give time to my family, but when I am free, not when they are free. So that is the only disadvantage. You need a lot of understanding between you and your family, you and your partner, you and your friends. So yeah, by now all my friends know I'm usually always busy, and they know that when I'm free, okay, she's free. So they try to make time. So yeah.
One piece of advice, what would you like to give our NEET PG aspirant who want to choose this branch?
Department of OBG.
OBG and gynecology.
It's a very good branch. It's very rewarding. To be very honest, it's the one branch that will give you good news. In a hospital, in a very depressing environment like a hospital, you're dealing with babies, you're dealing with new life. You're the first person to hold, somebody's baby, following their journey, 9 months journey, and then seeing them have a baby, or even infertile couples, giving them the blessing of parenthood. It's a lot. It's a very good branch. It's a very rewarding branch. You will be exposed to both medicine and surgery. You will have a good amalgamation of both. But it does take a lot of personal sacrifices from you. It is not an easy branch. It is a hardworking branch. It is a demanding branch. Once you take OBG, your life is not yours first. It's always your patient's first, okay, and then yours. I know a lot of senior faculty of mine who coordinate their vacations based on their patient's delivery date, So it's like I said, it's, there are sacrifices that have to be made, but, at the end of the day, it's, it's a lot on your personal liking. If you love the branch, take it. But if you don't love the branch, you should not. It should either, OBG is always a branch which I would always say is an all or none. It can't be a branch that if idi rakapote idi OBG తీసుకుంటా. It's never like that, because I was primarily interested in OBG. It was my first choice. Still, I thought I did a wrong decision a lot of times during that toxicity period, during the hectic time. So you will always self-doubt, you will always cry. Nobody gets out of OBG PG 3 years without crying. But yeah, so either it is OBG or nothing. Only then you go for OBG. And also a special advice I'll give, because a lot of men, male UG students, especially in South India, think that OBG is a primarily women's branch. It's nothing like that. Orthopedics and surgery have been bombarded by women. We women have not left that branch for you.
As you said this, actually I was interested in obs and gynae,
nice.
But in Telangana, patient won't accept to come near male.
True.
Male PG, ma'am.
No, but see, once you have the skill, let me just tell you, the most successful gynecologists in India are men. And we have surgeries like Shirodkar surgery, Purandir surgery. They are all men. All the amazing surgeries have been invented by men. Okay, and if you go in the north, they are surprised to see female gynecologists, because there are only men. And not just that, a lot of periphery government medical colleges, when I went for DRP, had male PGs. Okay. So it's a myth, and it's something that has been going on for generations, and I really think that it's high time we break that chain. But in fact, right now in my sub juniors in second year batch, there is a male PG in Niloufer.
Yes, ma'am. Recently joined in Niloufer Hospital.
Yeah, there is. So
and the sir also is from north only.
You can have one Krishna among all the Gopikas. But no, I would highly, if male PGs, I get a lot of queries from a lot of male PGs from other states who want OBG but are scared to take in Telangana, because they may not be getting in their state, but they're scared to take it here. But go for it. If you love the branch, trust me, you may feel that hesitation in the beginning, but then you will gel very easily and you'll feel happy. If this is what you see yourself doing all your life, then that is what you should do. Your PG is literally your first marriage without a divorce. So you have to be very sensible when you choose your branch, because you will be doing this for the rest of your life, whether you like it or not. So always, not just OBG, whichever branch it is, take a branch that you love doing and you see yourself doing for the rest of your life without getting bored. And it should, it should give you happiness at the end of the day. That is what is important. So yeah.
Thank you, ma'am, for spending your valuable time and giving genuine information. I think literally it helps a lot, ma'am, for young PG like me. Thank you.
No, but this was a lovely initiative, and I really, your commendable work. This is a good form that you're trying to help your batchmates and your juniors in choosing a branch, and this is very important because it's a very important decision of your life. So kudos to you guys for
Thank you, ma'am.
coming up with such a nice initiative. Congratulations.
Thank you so much, ma'am. Please like, share and subscribe for more content related videos. Thank you.
Bye.
Thank you, ma'am.
No.